Hello, my name is Joseph Johnson. For my profession, I chose osteopathic physician, specializing in physical medicine and rehabilitation. So, before I go into the specialties of physical medicine and rehabilitation, I wanted to talk about the difference between a medical doctor and a doctor of osteopathy, or an MD versus a DO. Now, a lot of people know the difference, some people have no idea, and other people think that they're completely different professions. And I wanted to dispel any confusion. So, is there a difference between DOs and MDs? Yes, but not as much as you may think. One of the biggest differences is the philosophy. Osteopathy focuses on a more holistic form of medicine. The goal is to treat the physical, mental, and spiritual aspects of the body and to find the root causes of disease instead of simply treating the symptom. The second biggest difference is OMM, or osteopathic manipulative medicine or therapy. What that is a type of manipulative medicine, kind of similar to chiropractic or maybe physical therapy, but it's still different. And it just gives you another avenue to try to help heal the body naturally, um, which can work in combination with pharmaceuticals, surgery, things of that nature. Aside from those differences, there's really no difference in schooling, residency, or even just medical knowledge. In fact, next year, in 2020, the accreditation boards, which are essentially the boards you have to take to finalize your being a doctor, it's like your final exam of med school, the councils are going to merge. So you'll be taking the same test. So there's really, aside from that, no difference. In fact, I've heard some people say DOs actually know more because they have to learn osteopathic manipulative medicine. So, about the profession. There are various specialties in osteopathy, the exact same specialties as MD, surgery, medical, and the one I want to specialize in is physical medicine and rehabilitation, or PM&R. Uh, the goal of PM&R is to provide treatment of conditions related to the nervous and musculoskeletal system, and the aim is to provide integrated care to improve health and ability, reduce pain, and enhance quality of life to patients with physical limitations and/or disabilities. Essentially, I like to say it's healing without surgery, or after surgery. I'll get into the specifics of the job next, but it's important to note that people you may work with are other physicians. A lot of times, PM&R refer to PTs, or physical therapists, and obviously you could work with physician's assistants, nurse practitioners, registered nurses, etc. In the setting, you would work in a clinical or office setting. So daily duties of the profession: prescribe medications, prescribe exercises or orthotics and prosthetics, or other adaptive devices such as a spinal orthosis, which we'll see in a second. You perform procedures such as injections, and you could consult with therapists, like physical therapists and other physicians. So specifics. I was talking to, or I'm sorry, I researched a doctor, and he talked about one of his cases of a patient with inflammatory myopathy, um, which you'll see in the upper left. It had weakened the extensor muscles of his spine, so he had trouble maintaining posture and physical activity, which led to a decrease in quality of life because he could not maintain upright posture. So he and the doctor worked out a physical therapy plan, and they prescribed him a spinal orthosis, which you see there, and that helped stabilize his trunk. There was no need for medication or procedures, just exercise and a brace. And apparently, the doctor said the patient responded very well and is doing just fine and has regained quality of life. Other examples include one doctor I heard of who used an intrathecal baclofen trial. Intrathecal means a catheter goes up into the spinal cord and it delivers medication, specifically baclofen, directly into the cerebral spinal fluid. Um, they put that as a way to treat Rett's syndrome, which was a neurodegenerative disorder in young girls. Another example would be ultrasound guided intra-articular injection. So you can see they're injecting into the bursa of the knee. Or such as another example would be prosthesis. I read about one doctor who prescribed prosthesis for veterans who had been injured in combat. So, what are the requirements for PM&R? It's the same for most any other medical residency. You need a 4-year undergrad. You need a competitive level of shadowing and volunteer hours and possibly even research. You have to take the medical college application test or MCAT. And if you do well on all that, you might get asked for an interview. And if you do well in your interview, you may get into medical school. So after 4 years of medical school, you will have 4 years of residency to specialize in PM&R, 1 year of general clinical, and 3 years of specific PM&R. Once you're a doctor, there is some continuing education by state. There are mandatory continuing educations for all specialties, such as abuse of controlled substances, prevention of medical errors, laws and legislation, and HIV and AIDS. As far as specifically to PM&R, there are professional organizations such as the American Osteopathic College of PM&R. They have journals where you can submit your own research and work. They have events and training, and they actually have memberships available to both med students and residents for PM&R. So I may look into that in the future. As far as my personal timeline goes, right now we are in the middle of the beginning of August. So I finished the summer undergrad semester and finished the MCAT, Medical College Application Test, and I also submitted my med school application a couple days ago. So in about 3 weeks, I'll start the fall undergrad semester, and in a few weeks, I'll also get my MCAT scores back. And around that time, about mid-September, possibly early October, if I did well enough, I may get accepted for an interview for med school. And if I do well in the beginning of that spring semester, I will hopefully get accepted to a school or two. And then I will be graduating from undergrad in April of 2020. And that summer, I actually don't have anything planned because I want to rest up before I start, hopefully, my first year of med school. And then that fall 2020, all the way up through spring 2023 is pretty much just going to be med school. Not much of a difference in those. And I'm sorry, it's actually fall 2023. So during that last year of med school, you apply for residency. And it's very similar to applying to med school. And in the spring of 2024, I will graduate of med school and hopefully get accepted into a residency, possibly PM&R. That's it. Thank you guys.